We're going to move on to central venous catheter dressing changes. The only equipment you need is a central venous catheter dressing change kit. Each hospital has these specialized for what they use in their procedures, so what you see here may not be exactly what's used in your hospital, but everything that you need should be inside of this kit. The first thing we're going to do, of course, is wash our hands when entering the room, check our patient ID, and check for any allergies to any medications, any latex allergies, or chlorhexidine allergies. We're going to gather the supplies, which, as I said, the only supply is the central line dressing change kit. Putting on our clean gloves. Next, we're going to open the central line kit. Each kit has an easy open. You just peel back and open this kit. Inside, you'll find your sterile packaging. We can touch anything that is blue with our clean gloves. So I'm going to set that down on the table, and you'll see that we have a little pull tab here. You're going to pull that and open it up. Remember, when you're opening a sterile field, you can touch approximately 1 inch in from the edge. Inside, you'll see that there is a mask on top along with our sterile gloves. I'm going to pull both of those out and put on my face mask. When you look at the face mask, you'll see that there is one side that has like a metal clip to it. You're going to form that so that it fits your nose, and then open this up, open all these folds. This side goes over your nose. If you wear glasses, fit it under your glasses and around your ears. Pinch it across your nose and pull it down around your chin. Next, I want you to take your fingers and form fit that metal strip across your cheeks. This will help to eliminate the mask from sliding up into your eyes and keep your glasses from steaming up. Okay, so we have completed taking the dirty dressing off of the patient. We're no longer have gloves on at this point. We don't need gloves because we're going to next set up our sterile field. Again, remembering your sterile principles, we can touch anything that is blue, and if we touch on the white, it has to be within 1 inch. So I'm going to pinch this and open, pinch this side and open, fold it down, pull it a little taut and it will hold, and then the final opening towards you. Now if it gets off, remember that you can turn this as you need to, using again just that 1 inch margin. Okay, Chester, I'm going to change your central line dressing. I want you to turn your head away from the dressing, or as an alternative, I can put a face mask on the patient as well. What we're doing is trying to keep us and the patient from breathing on that insertion site. So he has turned his head away. I'm going to remove the pieces of tape. First, make sure that you hold your catheter steady so that we don't pull the catheter out. Tape comes off. I just stick it on the back of my glove so that there's a place for it to go rather than putting it off onto my table. Next, I'm going to remove the dressing. I'm going to loosen around all the edges first. And remember, on these patients, their skin is pretty tender. So you'll see that this, as you pull this off, the skin will turn a little red just from the irritation of the adhesive being pulled off. So I've now loosened completely up. I'm going to pull, holding the catheter steady. I'm going to pull in the direction that the catheter is inserted. And get that all completely off of there. You want to pull in this direction so that if you pull on the catheter again, you don't pull it out. If you were to pull back this way, you would run the risk of pulling that out. Next, you just remove those clean gloves, wrapping all of that up and inside as you all learned last semester, and dispose of your gloves and dirty dressing. So our kit is set up to begin with. We're going to move to donning our sterile gloves. Again, you learned this last semester. This is one of the techniques that students tend to get stuck on. So this is something you definitely want to practice at home. We're going to open our sterile gloves. Again, if you'll pull those ends taut and get them completely open, you'll find that your kit will stay for you. I'm going to put on my right glove first, so I'm going to touch just the cuff and slide my hand in, keeping that over the sterile field. I tend to step back a little bit as I put that on. Because of my height, I will sometimes hit the table with the glove. You can see I didn't get it on very well, but I will readjust that as I get the second glove on. When you don the second glove, again, you can still touch that cuff with your non-gloved hand, but you need to slide the other hand into the cuff and slide your hand in. Again, you see that I stepped back a little bit to give myself some space. Once your glove is on, you can readjust so that the gloves are on properly. So next we're going to finish setting up our sterile field. I always like to see exactly what is in my kit. This one you'll see has a skin protectant swab stick. Set that aside. It has a povidone iodine skin prep pad. We don't use those anymore based on evidence-based practice. So I'm going to set it aside. We've got 3 Q-tips, our chloroseptic swab, some gauze, label for our dressing, and our Tegaderm. We're going to clean the site first using the ChloraPrep. Remember, you pinch these wings in, and then you want to center that over the insertion site and hold that for about 10 to 15 seconds. What you're holding for is for this sponge pad to get saturated with the ChloraPrep. You will be able to see that once it gets wet. Once it is wet, you can hold this catheter and you give a gentle scrub. Next, you're going to go around that site in kind of a square fashion, again using a little bit of a scrubbing motion. So I'm now about 1 inch out from the insertion site. I'm going to continue to scrub. You want everything that will be underneath the dressing to be scrubbed. So it should be a good 20-second, 30-second total scrub. Next, you're going to take the edges of your sponge and, starting at the insertion site, clean your catheter. And moving it periodically each time so that you are coming up with it. To get underneath, it's a good thing to use a Q-tip. Again, a fresh side of your sponge, not touching the catheter. You don't want to clean from the edge, from the middle down, because that would be pushing bacteria and such back into the insertion site. Next, I would use my Q-tips to, again, clean the insertion site. Sometimes you'll get some little crusties around there that might need to be scrubbed off a little bit better. The whole time you're doing this procedure, remember you are assessing your insertion site again for redness, swelling, drainage, pain, all of those things. You allow that to dry, and once it's dry, we can apply the Tegaderm. Peel the paper end off. This one is a little trickier than our peripheral IV because it's a little bigger. Sometimes it will catch back on itself, kind of like saran wrap. You see that there is a window. We want the insertion site to be directly in that window, and the U to house the part of the catheter. So we're going to place that directly on the patient. Pinch around the edges. I start at the insertion site and smooth out any air bubbles. Come down your catheter and smooth out those air bubbles. Once that is done, you can peel off this paper around the edge. Again, smoothing everything out. What you want when you're done is an airtight dressing across the patient. Attached to this piece of paper, you'll find little pieces of tape that you can then use to tape the ends of the catheter down to the patient. Lastly, we're going to use our dressing, indicating the date that the catheter was inserted, if you do know that, the type of catheter, the needle size, your initials, and then the important part is the date of the dressing change, and again, your initials. That will peel right off and just go on a corner of the dressing. And we've got that dressing completely changed. Everything is airtight and ready to go.